Now let's move on to the clinical manifestations of heart failure. Heart failure can present in a variety of different ways, and since we're considering infants all the way up to adolescents, its presentation can be very variable. The most important thing to start with in considering the clinical manifestation is the history. You may get a very varied history depending on the age of the patient, and it's important to ask specific questions that are age appropriate for the patient. In infants, a common presentation of heart failure is tachypnea, poor feeding, and diaphoresis. Their inability to feed adequately results in poor weight gain, and as such, many of these patients present with failure to thrive and cachexia. In younger children, their presentation can be very variable, and at many times heart failure is mistaken for either a viral syndrome or for asthma. Signs and symptoms can include malaise, fatigue, vomiting, GI pain, and recurrent cough. In older children, once again, many symptoms of heart failure can be mistaken for viral symptoms or for asthma. They usually present with exercise intolerance, abdominal pain, recurrent vomiting, wheezing, cough, edema, and palpitations. The physical exam is also a very important aspect of identifying heart failure and trying to stage its severity. Signs can include tachycardia, tachypnea, diminished pulses such as cool extremities that can appear mottled, and hypotension. On cardiac auscultation, you may also hear an S3, otherwise known as a gallop, which is secondary to volume and pressure overload. Signs of pulmonary congestion include wheeze, rales, tachypnea, and there can also be signs and symptoms of systemic venous congestion, which include edema, generally pedal edema in older children, and ascites or abdominal distension in younger children.